Hi everyone, it's Elise Kleckner. I am doing my week 3 flashcard presentation on HIV/AIDS. So, human immunodeficiency virus, also known as HIV/AIDS, starts out as a viral RNA genome that can affect anybody, anywhere around the world. According to Ford et al. 2024, it has a projected 600,000 people that will succumb to HIV every year. Um, it is now more prevalent than ever because people are seeking initial treatment because they think that they are sick, but then they don't end up finishing that treatment. And so it just spreads everywhere on their body. Pathophysiology. So the HIV virus is very unique because it actually doesn't enter the body looking like an HIV virus. Um, it just comes in looking like normal because of that RNA genome that it has. And it goes in, it enters a host cell, and then it starts to duplicate its own DNA. And then that is how it spreads across the body. So it actually targets the main cells that it targets are the CD4 plus antigens, T cells, and macrophages. Um, and then this leads to the patient becoming immunocompromised. They end up contracting tuberculosis. They contract lymphomas, bacterial infections. And this is what actually people who have HIV end up dying from is those secondary infections. They don't actually die from AIDS. So some risk factors, we have modifiable and non-modifiable. Modifiable number of sexual partners that you have. It's always important to try to limit the amount of sexual partners that you have. And obviously, if not, then, making sure that you know the status of your partner. Drug users. So, drug users end up sharing IVs with other people, needles, and that is how HIV is spread is through fluids, bodily fluids, semen, vaginal fluids, breast milk, blood. Some non-modifiable would be mom to baby. This can be contracted through the birthing process, after from breastfeeding, or even during the pregnancy itself. Also, and then finally, gender and sexuality. Obviously, nobody can change their, insides, their genders. Um, and the most prevalent community that is targeted or gender that is targeted by HIV is gay and bisexual men. Um, and these are the ones who end up with the highest rate of HIV positive. Some signs and symptoms. We have mucocutaneous ulcerations. Um, these happen from the secondary infections that the patient gets because their immune system is lowered. Also, swollen lymph nodes, another sign of just a common infection or a cold, so they don't end up seeking treatment. Symptoms, fever. Um, it presents itself in the beginning stages, just like flu virus. So once again, we don't end up seeking treatment, but that is our body's first way of trying to defend off a virus is to raise the temperatures. Also, body aches, muscle aches. This can happen because of loss of electrolytes from vomiting or diarrhea. And then finally, diagnostic testings. We have the ELSA, which is by far the most commonly used and heard of. This one looks for the antibodies that will be present in the saliva of an HIV positive patient. The Western blot, this one looks for you have a blood sample for this one, and it detects the specific proteins called HIV antibodies. It also has a 99% accuracy rate. And last but not least is going to be the PCR test or the polymerase chain reaction. This one's not usually used on actual patients. This is normally used for blood donations. This is how they check the blood to make sure that it is not HIV positive blood. All right, well, below is going to be all of my references here. I hope you guys enjoyed. Thank you so much for listening.